first times I've done this committee. Yeah. Oh, you know, in this cycle. Right. We have an agenda in front of you. And there are, I've been told there are resolutions at the end of item 6. If you haven't updated your packet, I would suggest you do that. Refresh. Okay, the agenda, your wishes?
We're good on quorum.
I'll move the agenda.
Moved by Brailer, supported by Rogers. All in favor?
This is the strategic plan.
Thank you.
You want to vote?
Yep, we just did. All in favor?
Aye.
Opposed? The meeting minutes from August the 5th.
Because he wasn't prepared.
Brailer and Rogers. All in favor?
Aye.
Opposed? Thank you.
Democracy at its best.
Okay, this is an opportunity for limited public comment, the first of 2. Did he say he was coming? Okay. Hearing none, we have another opportunity after this. Amy Delinky. Amy, how are you? We have the strategic plan in front of us, and I'll comment by saying it was totally a group effort, and I appreciate all the work that went into it from all the members of the team here, the commissioners, the public. We had really a massive response from the public. Amy helped us so much in some of the guidance, and Kaylin ran the whole thing out of the health department, and I appreciate all of it, and it was really great work. But now we've reached the culmination of the work, and it's time that we do something with this, with all this information that we've got. So, Amy, the floor is yours.
So just real quick before Amy starts, Amy filled in at the last minute today to go over the community assessment report that MSU did for us. Also in your packet is the strategic plan. You had it in your packet last month in July. I was gonna say last month, but that was August. That was in your packet in July, so those are both in there today. Amy specifically is going over the community assessment report from Michigan State University. And then there's a resolution at the very end of the packet to adopt both plans and to create the committee that will ultimately send out the RFP and look at all of the grant awards and then oversee all the grant awards once they're awarded. So, thank you, Amy.
Thanks. So Amy Delinky, Technical Advisor on the Opioid Settlement Funds with the Michigan Association of Counties. Thanks for having me back here. So as was noted, the report from Michigan State University, they have been providing additional no-cost technical assistance, which is what I provide at MAC, but they're providing a really specialized service in terms of a community assessment, which typically involves surveying the community, interviews, as well as focus groups. In this case, we were able to share the strategic plan, both in this final format as well as in the original format. So specifically the words used by the community members that were part of that planning process as another qualitative source of data to go into this report. So from the strategic plan as well as the community assessment, the recommendations are all combined into one to allow for kind of ease of use and to really see where the data, where some data supported the other data.
Amy, I would like to just ask, it's kind of a chicken or egg thing. Was it beneficial that they have our plan first to sort of craft theirs, or did we need theirs to craft ours, or how? What is your take on how that worked out?
So they had theirs first. So they shared with the county their qualitative report and their quantitative report prior to seeing the strategic plan at all, because these things were happening simultaneously. So we really were strategic about when we would input a new data source into that process to ensure that there was, you know, real clarity of where each piece of data was. Okay. So it wasn't until they were pulling everything together that we even sent over the final strategic plan with the edits and, you know, where everything was kind of streamlined. We really just made sure that each part had its component, and then we were able to pull it all together within the last few weeks here.
Excellent. And, I do want to thank MSU for that. They offered a resource that we just didn't have the power to do. They had people, they had surveys, and these are things that it just wasn't in our grasp to add this to our plan, and I really appreciate the work that they did. And they have a broad reach. They were all over the state of Michigan, not just in Eaton County or Ingham County. I don't know how many people that they helped or how many groups they helped, but I think it was fairly extensive.
About 35 counties they've been working with, and I think one of the benefits of working with them is they did provide a financial incentive for community members that were participating, so that way their time and energy was compensated. So in the report, if you go to page 15, this is really where the recommendations start, and, well, the bottom of page 14. And they're broken up into Tier 1 and Tier 2. Tier 1 are the initial priorities, the things that really should be taking place first. Tier 2 are items that, without implementation of items in Tier 1, will be less effective, but also are areas where activities can take place and should be taking place. So in Tier 1, transportation, of course, came up as a large component. So that's one of them. The other is just implementation of the strategic plan. So ensuring that the document actually is implemented by the community with support from either a staff person or a group of individuals providing the administrative support to that process. When it came to the transportation component, this is where you'll first see a note in the recommendation if there is a financial component. So some recommendations will require funding and some will not. So they did want to clarify in the report throughout. There's also recommendations around increasing access to and the number of peer recovery support specialists and peer coaches in the county. And then supportive housing. So housing and transportation, of course, very commonly seen throughout the state as recommendations, but much more challenging to carry out. And then in Tier 2, we see really some asset mapping and understanding of what existing resources are out there, which we saw in the strategic planning process, was that resources may exist, but not everyone is aware of those services or how to access them. Transportation, again, came up in that section. And then increasing distribution of naloxone. Of course, naloxone itself is free through the state, and I know you all have some other grants and things happening in that space. And then organizational training to reduce stigma. So stigma was kind of a common theme that came throughout as well. So that's a very general overview of what's in the recommendation report, which was sent over to the county late Friday. So any questions that I can answer about what that process was? As I think we talked about in previous meetings, the recommendations are not telling you where to spend money. They're saying these are the areas in which we should explore spending, or with a request for proposal process, highlight where folks may be able to have their proposals elevated or receive additional points if they're able to address these as priorities of the county.
I think those are really interesting, interesting comments, and it does give us direction. And the question that this committee has to look at is which of those directions are important to us and which one are even achievable. I mean, housing obviously is a problem, and whether we're able with our funding to do anything about that, unless we can find some partners. Transportation, maybe we're on the right track there with the expansion of E-Tran. We may have some opportunities there. Peer recovery and peer coaching, I think, is something we probably can actually have a little bit of touch into with our funding. So, as a group, we sort of need to wrap around where we want to head, because that's what this committee's goal is going to be when it comes to this. Commissioner Brailer?
I don't disagree with what you're saying. I do think that we need to be aware of what's happening around us. the state, the governor's office has encouraged the counties, the areas to look at the housing problem. And last year, the Tri-County area started a huge process to do that. I don't know where that's going to go. It's kind of moribund at this point. The lead people seem to have dropped off, and there doesn't seem to be continuing leadership. But I only mention that because housing is such a critical issue. And I think it certainly goes to the problems that people who have substance abuse difficulties often face. And so we need to be aware of what's happening around, and maybe if that process can be re-energized and continued, because I know there are people who are still interested. Perhaps we can partner with them in some way and bring that together. So I don't want to call it the low-hanging fruit, but because serving on the mental health board, I know how important peer recovery coaches are to the process. But that is kind of the low-hanging fruit in this instance. The bigger issues are, of course, as has been indicated, transportation, housing, and I think childcare as well probably fits in there as being a barrier to a lot of people receiving the assistance and being able to be successful when they receive that assistance. I do, since I have the floor, do want to take the opportunity to echo what you said earlier. Very, very pleased with all of the people who participated in this, citizens, the various organizations, and Amy's generous use of her time for Eaton County is greatly appreciated. I think most of you know that I've never been a particular fan of MAC, but she, as the face of MAC today, to me, has given them a positive look in my eyes. So you did a wonderful job for us. Greatly appreciate all of your help and your leadership in a lot of ways, and also MSU for their assistance.
Amy, you're a hero. Thank you. You really has helped us.
I will say, just looking at what I've seen in some of the other counties I'm working with, is after they receive this report, this is not me stepping out of supporting you either. So I am here to continue that support. But most counties that are moving towards a request for proposal process take these and really input them as the county's priorities into that request for proposal and really let the community tell them what's going on. So maybe there's someone out there working on transportation or housing or those more complex issues. And so I think they've really used this as where they stand and then allow folks to really share where those spaces are. But having them provide the data and information for those specific activities. So thank you all for letting me be here today. And yes, around to continue supporting however I can.
Well, and we talk about transportation and housing, and we look at it, it's a giant issue for a lot of people, but in context of what our committee is dealing with is use and misuse of substance abuse, and so there's a certain element of people that we're going to concentrate on and should concentrate on, and they're people that they're addicts or recovering addicts, and frankly, their lives are pretty crummy, and for them to get a lease or be able to make lease payments, it's extra difficult for them. And transportation, again, the people that are involved in the cycle of addiction really have gotten themselves in a deep hole. So
the other thing is I sat in on some of the meetings of the committees, and there was discussions of perhaps being able to put together a house in which several recovering people could live. So it's not just, I don't think this issue really looks at just the idea of being able to find an apartment or find a house for an individual. I mean, that's certainly part of it. But there also may be some way that we can put together some kind of a group home or a recovery home where people who are transitioning back into the public may be able to find a safe space to allow them to continue their recovery for a period of time. So there may be some other ideas that are smaller than the bigger picture.
And we actually have a couple of homes in Eaton County that you may not be aware of, and they deal, they're generally with the faith-based side, and there are some really great homes in our county that people that are recovering addicts live in, and they're quite strict. I've one that I'm well aware of and been involved in. I mean, the person has to live there for almost a year and expected to follow the rules, and it's just another step in their recovery, and it's, they're here. We have these places. Granted, we probably can use more, but, even supporting some of these current efforts might be something that we could look at.
One of the barriers to this, when you said that, reminds me, when I first started practicing law back in the 1980s, there were inpatient programs, and if a client of mine went into an inpatient program, it was generally viewed that it was at least a 6 months to a year process. And generally, I would say most of it was a year. And there were actually there was insurance to pay for that. Well, then the insurance companies decided that they would only pay for 30 days. By the time I left the practice of law and retired, it was down to 3 days. So we also need to kind of look at society and maybe go back to some of the things that were being done a long time ago. Because I frankly don't think there's anyone out there, maybe there's the occasional person who with 3 days of inpatient assistance can come out and have a really strong opportunity to recover. But we used to have a lot more of those homes available or those places available than we do now. And it's largely because can't get anybody to pay.
So the resolution that's in the packet is a resolution to adopt the strategic plan in conjunction with the community needs assessment. They go together. And then to create the committee that will have oversight for that. So that's called the Opioid Settlement Oversight Committee. The work group's recommendation for that committee, the chairman's opioid work group, is for that work group to be part of the committee, somebody from the public health community, and then a person or persons with lived experience with substance abuse, or a family or friend of a person with lived experience. So the resolution adopts the plan and creates that committee.
I would move the resolution.
Support. Moved by Brailer, supported by Mudry, to adopt the resolution for accepting our studies and our strategic plans, and to create another committee that would actually do the work. Any questions or comments on this? Commissioner Rogers?
Is this a temporary committee or a permanent committee?
My understanding from the work group is that this will be a permanent committee, and it'll be on the first of the year when we do the committee on committees and make our resolutions and put citizens on committees, that this would be in the committee of committees, the 3 commissioners that would be on this committee would be appointed at that time. Now, this particular work group committee, the Opioid Settlement Oversight Committee, they'll actually have some work to do in that they're going to have to put out the RFPs for gather the direction that we as this committee wants, and put out the RFPs for the work that we want done, this committee. And then they will also have to gather in the RFPs, use some sort of a scoring method, and determine where the funds are going to be spent. And these are yet to be hammered out, but we have a pretty good idea of what we're thinking about. And I, for one, would like this committee to work a little bit longer term and maybe have a 3-year process is what I'm thinking. I don't like the committees that every year have a certain bucket of money that they spend and then they redo it the next year. I'd like to put a little more length into it so that, you might, then when the RFPs are accepted or we determine how we're going to spend the money, that there's at least a little more of a timeline for that recipient to understand what they've got and how long they can use it. Otherwise, you're always running out of money and starting the process over again. So, but again, that's for this Health and Human Services Committee to sort of determine what the direction and the scope, and not this committee's, this one specifically, but in the future, this committee will be the one that dictates the direction of the opioid settlement committee. So, inputs?
I think the opioid settlement money is supposed to be spent over a period of time anyway.
Correct.
Significant period of time. So this committee would certainly last that period of time, and hopefully by then we'll have access to further monies, because the problem will always be with us to some extent.
And I think this committee, you know, if they're wise, they'll be, and this committee here, I could talk about, there's two committees we're talking about, the opioid settlement committee and this Health and Human Services Committee, but if we're wise, you know, we'll look at RFPs or possibilities of possibly partnering that money in certain aspects. I mean, when you've got money in this area, often it's very helpful to use it as seed money or use it as matching monies for other programs. And, you know, I think you get more bang for your buck that way. And I would hope that that will be the direction we go. But again, it's going to be up to these committees to make that decision. So I guess do we want to get it set up this year yet? That's my other question. You know, it's, we have a few months left.
The work group had talked about being able to distribute funds before the end of the year, or at least making the awards by the end of the year, so.
That's a pretty tight timeline.
You said somebody else had a lot of work to do, but you might have a lot of work to do instead.
Yeah.
I would certainly like to see them go forward. I mean, I think in any of these types of projects, and I'll go back to the housing, the Tri-County housing thing at this point, once the momentum is lost, you lose a lot of people who were participating. And so I would like to continue, if we can, and continue that momentum that has been built up. I think that would be very helpful to ensure the continuity of this project.
Yeah, Jim.
Yeah, I echo that, because with two people on the work group are going to be leaving, so it'd be nice to have, you know, you two involved in getting this established and up and running, so that the next, you know, when we group commissioners that are going to be on the opioid committee, kind of have a foundation to work with that, you know, you two help set up.
And I think the only person on the committee then that really is in doubt would be the community member. We all have a couple ideas. We have people in mind. The part from the health department that we're,
What you had
It's not
talked
really the health
about at the
department,
work,
it's the-
yeah, what you had talked about at the work group was maybe somebody from ECH.
Yeah.
So maybe Callie Dempsey.
Yep.
You had talked about, and then you had talked about a couple different community members, either lived experience or a family or friend of lived experience. You had had a couple ideas on that too.
yep. So I think we could put a committee together in fairly short order.
Any chance that you've moved into the Eaton County area? I keep trying.
Amy is here today, so, and the three of you are all here, so we probably should put our calendars together and try and find a time in the next couple weeks to meet and start on the RFP then. Amy gave us a bunch of information that's a good starting point, so some of the work's already done. It just needs some finishing work to do with the strategic plan and recommendations.
Well, and, you know, I talked about, you know, 3-year stretches, and I don't know that has to apply to the first year that we're starting the process. You know, we're just getting our feet off the ground and starting to walk in the direction. And I'm, you know, I think you're right, Mr. Chairman, to get the thing going, get something started, give a foundation for the next Health and Human Services Committee to know that we've got it. We're not just throwing it in their lap with no experience, no background, you know? So,
You can do some that have a long-term to them, like the 2 or the 3 years, but then you could also do short-term, and then you can also designate a certain amount of money for any type of emergencies that you may want to cover. So there are a lot of ways, sorry, I feel like I'm excluding Mark. So there are a lot of ways that you can include all of those things in the structure that you put together for it. But I don't think we voted yet, Mr. Chair.
I was gonna say, we've gone into discussion, we started the discussion as the discussion for the vote, which it really is. But let's vote and then we can continue the discussion. All those in favor of these resolutions, of this resolution?
Aye.
Those opposed? Thank you. What, we ask this regularly, but I think, and it's a moving target, but give us some dollar numbers that we've got to work with, just so that this committee understands what we're talking about. You know, there's dollars that come in that trickle in annually. There's dollars that we've already received that were one-time dollars. And there's a pot there, and most of it is restricted. It requires that it's being used for this purpose. A little bit of administrative costs I think you can use, but for the most part, it needs to be for the purpose that we're discussing here.
Right, so we were looking at between 375 to 400,000 per year. And that could change because we have a couple more settlements that we're awaiting. I believe in the fund right now, we have over 2 million. I could look really quickly.
No, that's fine.
So you're able to start a program and you look at that long-term, like a 3-year program. But I think what we've been talking about within our office is to ensure that we have parameters to make sure programs are actually functioning. Oh, you have the, well, you could have spoke. Said I'm stealing your computer. So yeah, right now we have 2.2 million, and we're looking at, well, Claudine, you should have looked at it. You're looking at this shows only 166 per year.
It's a couple months old, but
Yeah, no, I think we're actually looking at additional funding, so it's probably around between 300,000 to 400,000 when all is said and done. But remember, we got the Meyer settlement, which was 1.5 million, that most municipalities didn't get. So that helped our fund balance.
So 300,000 basically with some startup money. Now, of course, we're looking at groups that are gonna want the money, and whether we're gonna go all in with one particular direction, whether we wanna spread it around in a couple of different directions, you know, that's all the kind of input that this committee and the committee we're gonna create will be involved in. Any input from this committee at this point?
You know, over the years, I've served on the coordinating committee for substance abuse for the area numerous times, and I'm on that committee now. And that's always been the discussion. There's always been a limited pot of money for substance abuse. And I've often wondered, because the general decision has always been to dole the money out a little bit, covering everything, so everybody gets a piece. And I've wondered if maybe it wouldn't have been better to concentrate in one area for a period of time. And I'll use peer recovery coaches as an example. You have a limited amount of money, so we put it into training and providing X number of peer recovery people, perhaps as an example. And the longer I serve on these things, the more I think that you need to dedicate and point to one thing, get that solved, or at least get it improved, and then move on to something else. So that would be my initial thought.
Historically, we had peer recovery coaches at the health department, and as funding was changed and direction was changed, you know, those positions all disappeared and went to private groups or to community mental health, or I don't remember where they all ended up, where it all went. But we had three, I believe, three peer recovery, and they were involved with XAG. XAG was part of that process. And we had a somewhat robust system where where recovering addicts had an option, and they had some people that could work with them. And what's positive about that system is that it's localized. You know, you can really keep it in our area. You know, those that have suffered the substance abuse are essentially, you know, we want to deal with Eaton County residents, and we never really had that as an option before. And since we've lost those recovery coaches, we don't really have that as an option. I think they're outsourced all over the region, and I just throw that one out there. I mean, it's something that it's an option or something we can work toward.
Well, I can say certainly from the mental health side of things, they have found that peer recovery coaches are extremely valuable and important in the ongoing services that they put forward. As someone who has attended AA in the past, it wasn't the 12 steps that I found particularly helpful. What I did find helpful was the people who had gone through this before me, who were a part of the AA process, and that you could have conversations with and form bonds with. And so I think that's certainly an area of great importance for people who are struggling with problems, which cover, it's not just the substance. It can affect your entire life in terms of your, as we know, in terms of your family, your work, whether you have a place to stay. So to have those people available to you that you can trust and sit down with, and they can help ease your pain to a certain extent with their advice or just their friendship.
The MSU study, did I miss it? But was there very much involved with treatment on that side, on their analysis? Was treatment in there at all to speak of? There is certainly,
Did you find it, Amy? I have the paper copy. I'm kind of flipping
I'm whipping through it here. That's another area that, you know, has some local benefit, I think. I just found it. And I'm thinking out loud of how we can use it here at the county with our youth. I always think that, you know, that's on our minds right now, and it's with the opening of the additional beds at the youth facility. I mean, that comes to mind as an area that might be of benefit for some of this funding. Again, I'm throwing out this as one of the things we might want to think about. So after this meeting, we will huddle up and talk a little bit about putting this committee together and get some names of people that can be on it. And I would hope that by the time we get back to Health and Human Services next month, we'll be able to have some definite plans and results and be able to give a report. So if we'll have that on the agenda, we'll, again, I'm looking for input from all commissioners if they have some ideas or they have particular interests. But again, this committee itself is the one that's going to be mainly responsible for this particular activity. So, which, you know, is great to have a working committee that can delve into this particular area and funding these groups. Appoint someone to this particular committee we've been discussing before that, because if we're going to get some action done, we can't wait until December to appoint someone to this committee. So
You could do that at the board meeting
we could do it at the board
when
meeting.
you do the resolution.
Yep, that's a good idea. So that puts a little deadline on us to have found a couple of members for this committee by the full board meeting. Okay. Seeing no other business, time for public comment. Seeing none, we are adjourned.